Almost half of American adults have obesity, a condition that was a fraction of that just 40 years ago. And scientists don't agree on what's caused the dramatic increase. What everyone does agree on is that it's a major health crisis, because obesity can cause type 2 diabetes, hypertension, stroke, and more than a dozen cancers. Now there's a medication that leads to dramatic weight loss, but it's wildly expensive. Hollywood celebrities take it to flatten their tummies, but few can afford the thousands of dollars it costs a year. And very few insurance companies will cover it, even though in 2013, the American Medical Association, some would say finally, recognized obesity as a disease.
The story will continue in a moment.
It's a brain disease.
It is?
It's a brain disease. And the brain tells us how much to eat and how much to store.
Dr. Fatima Cody Stanford, an obesity doctor at Mass General Hospital, an associate professor at Harvard Medical School, says common beliefs about obesity are all wrong.
It is your turn to get on that scale.
And diet shows, like The Biggest Loser,
You lost 128 pounds.
are snookering people. If you diet, you lose weight, right?
For many of us, we can go on a diet, something like The Biggest Loser, right? You go and you restrict people, you make them work out for 10 hours a day, and then you feed them 500 calories. For most people, they will acutely lose weight. But 96% of those participants in The Biggest Loser regained their weight because their brain worked well. It was supposed to bring them back to store what they needed or what the brain thinks it needs.
So willpower?
Throw that out the window. My last patient that I saw today was a young woman who's 39, who struggles with severe obesity. She's been working out 5 to 6 times a week, consistently. She's eating very little. Her brain is defending a certain set point.
A set point, says Dr. Stanford, is a range of weight your brain is in charge of maintaining by controlling how much food you eat and how much of it you store. One theory is that it's an evolutionary survival mechanism that helped retain fat during famines. So we had COVID. Lots and lots of people gain weight. Do those people have a new set point that's higher now?
Absolutely. So when you have a chronic stressor and you get to a certain weight and maintain that weight for, let's say, at least 3 to 6 months, then you recalibrate that set point to a different set point.
I've always heard that it's the fast food, that it's the Diet Cokes, that kind of thing, that is the instigator. Is that true?
So I think we have to look at the different causes of obesity as a big pie. And that's one factor. But notice how I'm using this part of the pie, right? But the number one cause of obesity is genetics. That means if you are born to parents that have obesity, you have a 50 to 85% likelihood of having the disease yourself, even with optimal diet, exercise, sleep management, stress management. So when people see families that have obesity, the assumption is, what are they feeding those kids?
Yeah.
They're doing something wrong. Actually, do you know this? 79 to 90% of physicians in the United States have significant bias towards individuals that are heavier. Now, doctors listening to me may say, oh, it's not me. Hold your horses, because has that patient come to you and told you, look, doc, I'm eating well. Look, doc, I'm exercising. And the doc says to them, are you sure? I don't believe that that's really what you're doing.
Wait, are you saying that doctors don't understand obesity? Doctors?
Doctors do not understand obesity.
In one of her published studies, Dr. Stanford found that most medical schools don't teach that obesity is a disease, and in fact don't even offer courses on it, even though it's the second leading cause of preventable death in the country after smoking. Nicole Sams, mother of 5 from Rhode Island, spent years going to doctors who all had the same message.
Well, you just have to go see a dietitian. And I did. I did everything I was told to do. I went to a dietitian. I sat, had the rubber foods come in front of me. Oh, only eat this portion. I'm like, oh.
Maya Cohen went on her first diet when she was 13. At her heaviest, at 5 feet tall, she weighed 192 pounds. Did you feel that people looked at you and said, why doesn't she stop eating? She's eaten her way to that.
You know, you look at someone and you internalize, oh, they must think I'm eating too much. So it's just after a while, you just personally think that, okay, everyone's telling me that this is a flaw in my character, therefore it must be true. And so you start believing this.
Don't you think if people walking down the street with obesity, stigmatized as they are, shunned, don't you think if they could lose weight and keep it off, they would?
Dr. Caroline Apovian, co-director of the Weight Management and Wellness Center at Brigham and Women's Hospital in Boston,
Exercise is good, walking a lot.
who sees both Maya Cohen and Nicole Sams, is relieved that at last she has a highly effective medication to offer her patients that's safe, according to the FDA.
What the medication does,
It's part of a new generation of medications that brings about an impressive average loss of 15 to 22% of a person's weight, and it helps keep it off.
A major issue where
Doctors Apovian and Stanford have been advising companies developing drugs for obesity, including the Danish company Novo Nordisk, an advertiser on this broadcast. It makes the drug Wegovy that you inject yourself once a week with something like an EpiPen. It's not easy to get. The drug is currently in short supply, and it costs more than $1,300 a month. People in Hollywood can afford these expensive injections, and they're taking them.
right.
And they're not necessarily people with obesity.
Yeah. We have a national shortage on these medications. If those that have the means are able to get them, yet the people that really need them are unable to, then that creates a greater disparity, right? The haves and the have-nots.
The vast majority of people with obesity simply can't afford Wegovy, and most insurance companies refuse to cover it, partly because, as AHIP, the Health Insurance Trade Association, explained in a statement, these drugs have not yet been proven to work well for long-term weight management and can have complications and adverse impacts on patients.
what we've seen so far is really nausea, vomiting. You know, that's why these drugs are dosed slowly and starting with low doses
And build up.
and build up.
Dr. Apovian says most of the side effects go away over time.
We are frustrated every single day when we see patients who desperately need to lose weight to reduce the diabetes, reduce the hypertension, stroke, heart disease, and we can't give them this fabulous, robust medication that is very effective and safe, and we can't give it to them because insurance won't cover it. I receive emails about denials that state that we're denying this because the doctor has not counseled the patient on behavior change as part of this. That's where the stigma of obesity comes in. The idea that the patient can do it with diet and exercise. You would never do that to a patient with hypertension or heart disease or type 2 diabetes. Tell them that you just don't eat sugar, you'll be fine.
Novo Nordisk also makes a drug for type 2 diabetes called Ozempic, which most insurers and employers do cover. What frustrates the doctors is that Ozempic and Wegovy are exactly the same drug, though Wegovy for obesity is usually prescribed at a higher dosage. When Maya Cohen wanted the medication for obesity,
My insurance company told me that they considered it a vanity drug.
a vanity drug. So that suggests that the insurance company does not consider obesity a disease.
Correct.
Nicole was also denied coverage. On its website, her health plan, through the state of Rhode Island, puts anti-obesity medications in the same category as drugs for erectile dysfunction and cosmetic purposes. There are about 110 million Americans eligible for an anti-obesity medication, making it a costly investment for insurance. But if they covered it, overall government and private healthcare spending would probably come down. Just take diabetes, that is in many cases caused by obesity. Diabetes costs more than $300 billion a year, most of which is covered through Medicare and Medicaid. But University of Chicago healthcare economist Thomas Phillipson points out that there's actually a law that prevents Medicare from covering weight loss drugs. You would think that that insurance program for older adults would see an enormous benefit to these drugs.
Yeah, a third of Medicare spending is diabetes, and which is highly tied to obesity. And Medicare kind of sees all the healthcare expenses when you get older, when you have the heart disease, et cetera, from your obesity. I think what ultimately will drive it is that they have evidence that this is actually going to lower total Medicare costs.
Great, great.
When Dr. Apovian told both Maya Cohen and Nicole Sams that their obesity was not a weakness of willpower, they were blown away.
I looked at her and I said, I don't believe you. What do you mean it's not my fault? It is my fault because it's what I heard for my entire life.
I went home that day like a boulder had come off my shoulders. Like, okay, there's finally hope. There's hope.
Did you cry?
I did. A lot.
All those years of thinking that somehow you have no willpower and it's your moral failing and you're a glutton and why did you eat so much and feeling shame. It's the shame.
Yeah. It's the shame.
It's the shame.
Maya was ultimately able to get the medication covered by her insurance because she has type 2 diabetes. She's lost more than 50 pounds. Dr. Apovian says she does have to continue dieting and exercising.
Put your back up against the...
And like most patients, will be taking the drug indefinitely to maintain her weight. Nicole doesn't have type 2 diabetes. Nicole, we called your insurance company, and they gave us a statement.
Okay.
Earlier this year, the state of Rhode Island, in consultation with its pharmacy benefits manager, decided that health insurance for the state of Rhode Island employees would cover the entire class of anti-obesity drugs.
Really?
This coverage change goes into effect January
Okay.
2023.
I'm so happy for you.
Yes. This is great. This is great. Wow. Wow.
In its statement, the Health Insurance Trade Association said obesity is a complex disease and the evidence and clinical guidelines related to obesity treatment are evolving rapidly. Health insurance providers will continue to review the clinical evidence.
We're just giving patients a little more of that fullness hormone.
The Science of Weight Management Drugs at 60minutesovertime.com.